You all set, sir? Good evening, everybody, and welcome to the May 21st meeting of the East Lyme Board of Selectmen. I'd like you to help me by starting the meeting with the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. No additional agenda or consent. Any delegations? Anybody from the public like to speak under public delegations? Mr. Bialowitz.
Good evening, Mr. Formica and other board members of the Selectmen.
Good evening, sir.
My name is John Bialowitz Jr. of 61 Walnut Hill Road. I would like to know what was there any discussion on or action taken on the matters I brought to your attention last meeting. The first one was about the curbs on Walnut Hill Road. They're going to be fixed by CLP or the solar farm and done right. The second is about the removal of the poles on Walnut Hill Road. Are they going to clean up the mess, the rocks, the hay, and finish the job by loam and seeding the areas disturbed? My third question that I brought up to you is the Wetlands Department going to leave the cease and desist on the solar farm on? There is still silt in our stream and our nieces. The solar farm, there's still silt in nieces. We have not been notified by anyone from the solar farm for permission to go on our properties to clean this up. I know what their answer will be. If not that bad, it will clear itself up by itself. My point is, it wasn't there before, their mistake, so it must have fallen from the sky and we don't have any control of that. My last question is about the building inspector, Joe Smith. Was he asked how he changed his mind now on the 3-inch washers and the H258 clamps he put on my plans for my bond? And then I ended it, and then we had a car and a bike accident on our road right below our house yesterday, and I forgot one thing. I got distracted about the accident, and while I was writing this letter, I forgot about my insurance. If I had to make a claim because it was built to code, would I be able to get my insurance? And that's it, very fast tonight.
Okay, thank you, Mr. Bialowitz. Anyone else like to speak at public delegations? Ms. Rack or Mr. Mingo, whoever.
Good evening, ladies and gentlemen.
Good evening, sir.
I want to bring you, or inform you about what the significance of wetlands are in the town of East Lyme. I've got a little map over here, and it's kind of hard to see. But in the town of East Lyme, we have three major stream beds: Latimer Brook, Patagonia River, and the 4 Mile River. And when you get in the northern reaches of town, up where Yale owns, the wetlands up there are totally incredible. Beaverbrook Road is totally incredible on both sides of the road. You have beaver ponds up there, an overabundance of water. And the reason why I'm pointing this out is, in the town of East Lyme, our drinking water depends upon wetlands to recharge the aquifers. And these wetlands have to be protected at all costs. Otherwise, we're going to be like California, and we're going to have to start importing bottled water. So it's very, very important that we protect our wetlands. In the town of East Lyme, we have an organization called the East Lyme Niantic Land Conservation Trust. There are several parcels of land, and we have approximately 26 parcels in town. Most of them were, and I hate to use the term cast off from subdivisions. What they are wetlands that were affiliated with subdivisions that were turned over to the town or to the land trust with conservation easements on them, believe it or not, that the job of the land trust is to enforce the conservation easements, to make sure that we don't have filling and encroachment. And like I say, we have 26 significant parcels in town. Most of them, with the exception of those that are up on Oswegatchie Hills, we have 7 parcels up there. Some of those parcels have wetlands in them. But we're a volunteer organization. So I'm kind of gonna do a little bit of advertising for anybody who's interested in joining the land trust and getting involved with maintaining the trails, the walking trails, and protecting the wetlands in our borders. I'd welcome anybody who's interested in joining. The second issue I have tonight is we've had 4, some minor, some major storm events. The Latimer Brook, Niantic River estuary has been inundated with mud and silt. As I stated in a letter I wrote to the editors, the first one was tragic, the second one was criminal. I don't know what I'm gonna call the fourth one, which happened last Saturday with Friday night's rain. There was a stream of mud from the Boston Post Road where I took a picture all the way down to the ocean. The waterfall over Latimer Brook was boiling mud. I'm not gonna accuse anybody of where it came from, but I need to get answers from the town officials as just where the hell it came from, because I had someone tell me it didn't come from here. I should have said, where did it come from? And what I do have is a plane flyover, which I can't divulge because of the fact that it wasn't licensed, but I have proof of where it came from. And somebody's gonna own up to it. And I'm not looking to cast stones here, but immediately, there has to be some remediation here. And I don't mean running out with some grass seed with a little whirly jig and spreading grass seed on the side of a hill and expecting it to grow. Should have been hydro-seeded, or like they did here on Flanders Road behind that building, they put mats down with grass in it. And I realize it's quite a large area, but these people can't keep, and I'm not accusing anybody because there's somebody else involved here too. They weren't the only people. There's another organization that's responsible for some of this. Not a lot of it, but some of it. It's gotta stop, and it's gotta stop now. I don't expect to see mud in the Latimer Brook or the Niantic River during the next rainstorm. I don't know what they have to do, but they better do something, because it's criminal. The brown trout laid their eggs in the Latimer Brook. As soon as they get silted over, it dies. The eels are the same way. The herring run right now has been tremendous. That's been compromised. Salamanders have been compromised. We can't keep destroying the environment. We must protect the environment. And I'm just asking for some help. Someone has got to get the answers and put a stop to this, and I don't know who it's gonna be. I know the Siting Council has hung us all out to dry, because they've washed their hands of the whole thing. They don't care. So, it's a tragedy, and all I'm gonna say is that wetlands are the source of our drinking water. I don't care whether they're up in the northern end of town or down here. The water has to get into the aquifer to get into our wells. If we destroy the wetlands by silting them over, we destroy our water system. Here's a map here. If someone wants to look at it, I'm gonna leave it here. Just get an idea of how blessed we are in this town with wetlands and watercourse. I mean, we have a huge amount of water in this town. Of course, the DEP won't let us take it because of the fishies, but we have an overabundance of water in this town, and we are blessed. Go out west and ask them what they're doing about water. They don't have any, but we have a lot of it, but we have to protect it. I thank you for your time.
Thank you, Mr. Mingo. Anyone else like to speak under public delegations? Ms. Rack?
Good evening, Karen Rack, 27 Black Point Road.
Good evening.
I received a letter from the town of East Lyme concerning solar panels. And I was a little disturbed by it because within the letter it says the town has reviewed, I want to know who the town is, has reviewed and interviewed several companies and in partnership with CEFIA formally selected Encon Solar as our chosen installer. We believe, I kind of, who's we, believe they are the best fit for our residents. That's what it says in this, I guess every resident was sent. I guess now in our geographic region called the town of East Lyme, it now stands for communitarianism, which subsumes the individual to that of a collective. That's what we've come to here. The community is now defined as some sort of all-encompassing entity taking precedent over the individual. Personal autonomy with this communitarist view is at odds. And it's quite disturbing. Thank you.
Thank you, Ms. Rack. Anyone else like to speak under public delegations? Hearing none, the next item on the agenda will be the approval of minutes of the meeting of May 7th, 2014.
Move to approve the minutes of the East Lyme Board of Selectmen meeting of May 7th, 2014 as submitted.
Motion is made. Is there a second?
Second.
Second. Any discussion? All those in favor?
Aye.
Anyone opposed or abstain? Just for the record, we have two selectmen missing. Mr. Nickerson is away on business. Mr. Wilson is representing the community at the annual Law Enforcement Awards Dinner, which Dana Jezierski is being selected by the town of East Lyme and being awarded as the Law Enforcement Officer of the Year this year. And I believe Forrest Andrews is the Dispatcher of the Year for helping to deliver a baby over the dispatch line. So that's why they're not here this evening. The next item then would be the consent calendar.
Move to approve the consent calendar for the meeting of May 2nd, 21st. Sorry, there's a
Is
comma
that what
there.
it says?
Yeah, it's May 2, but
Comma's in the wrong
12/014,
place,
so
yeah.
10,000 years from now. Move to approve the consent calendar for the meeting of May 21st, 2014 in the amount of $7,280.70.
Motion is made and seconded. Is there a discussion? All those in favor indicate so by saying aye.
Aye.
Anyone opposed? Motion carries. Next item under new business, the first item is the Care Hair presentation for the clinic with a potential action. I have mentioned this item a few times to the board and around the community. This is, as you recall, I did travel down to Care Hair headquarters in Nashville with our healthcare broker to look at this new model of really focusing on healthcare, not sick care. It's a way to provide a clinic through our community that will provide services to our town staff and our retirees, and then potentially out as an expansion into other towns who are self-insured. And this model is designed to provide benefits really in two ways, although there are many benefits beyond that. One is cost efficiencies, deliver service, as you know, in a self-insured insurance environment. The town has a self-insurance fund. When claims come in, we pay an administrator, in this case Anthem, next year Aetna, to review and pay those claims out of our monies. So this is a model that's designed to produce those services more efficiently, and we're going to talk a little bit about that. And the other part is cost avoidance, where there is a risk assessment, a health risk assessment by our employees done at the clinic, and the baseline is established, and the employees then are working with the doctor and healthcare coaches and providers throughout there to kind of catch any health problems before they exist. So there's cost avoidance as well as cost efficiency. So what we're going to learn tonight, we have representatives from Care here Jessica Ricks and Sue Hart are here tonight. They're going to make a short presentation to explain in detail roughly what I'm talking about. We are hopeful to initiate this program. I think you'll see that there are real dollar savings as a result of this, and this is kind of the wave of the future. There is a tendency for a lot of individual physicians and healthcare providers to be kind of gobbled up into the hospitals and taking their practices into the hospitals and kind of bringing them all in under those wings. And I think there's going to be a situation in years to come about providing health care by local physicians. And so this will be an opportunity, I think, for the town to take a proactive means in this. I have provided the contract to the town attorney for his review. But what we'd like to do is kind of have an interactive.
We're working.
Huh? It's not working? Okay.
It's not connecting. Like it's not, the projector's not seeing.
The projector's not on?
Yeah. No, the projector's not. It's not recognizing that the computer's connected.
Okay.
And I don't know.
It's not that you need more cable.
No, it's not. It's just the fact that I have no idea.
No, it's
Oh, no? We
Do you
had it
have
going.
Do you have the clicker, the remote for the projector?
I don't know if that remote is the remote.
what does this go to?
That goes to the audio. That's just,
You need the remote for this?
yeah.
Can't we access it on that?
The only thing that's here is the on-off and video mute. Cause I'm looking for source.
Huh?
Source. Because it's on video. I want to grab a computer.
If you went onto the computer thing, that the projector's on. So if you went onto the computer, computer table.
There we go.
There we go.
Good job.
That's all you.
Men of many
Why don't you
talents.
swap spots?
That's why we have teenagers in the building. They can fix these things. And they pretend to make me look good.
All right.
Okay. You got it from there?
Yeah.
You scared me for a minute there.
Thank you for helping me.
I was going to call Bill Shear to see if he could come down here from Whistletown Road. He would not have been happy had he made the trip. That's farther than you lived, Mr. Bial, once, I think, you know? I know. So anyway, we've been investigating this option. We think it's a good option. I'm excited to present it to both the board and the community. I have spoken to mayors and first selectmen in adjoining towns who are also self-insured, who have shown some interest in this and perhaps potentially partnering or eventually kind of establishing a clinic of their own. So I'm going to introduce Jess. Are you going to be the one
Yes.
to provide us with the information? So welcome and thank you for coming, and you're going to show something here.
Yes, yes. Well, thank you all
So
for.
if I just might, maybe the best thing is you can show Jess and then focus the camera onto the screen,
Okay.
and then they can follow along with her voice
That's great.
in the background.
All right.
So do you want to sit here or go down to?
Move around.
I think we're gonna
Go
move.
down there?
Well, for those of you up there, I have some documents. I don't know if they've been distributed already. One is the printed version of this PowerPoint, as well as a projection that we'll review as well.
Do you want to run through the PowerPoint and then talk about the projection,
Yeah.
or is it kind of in the middle?
That'll be fine, or I'll let your questions kind of steer where we go as well. All right, well, thank you so much for having us here today. We really appreciate the time and to be able to explain what this model is all about and hopefully answer any questions that you have. Care Here was founded about 10 years ago. We are an on-site clinic vendor. So for those of you that on-site clinic might be a new term, I'll kind of give you the high-level overview and hopefully we can dig a little deeper together. We place on-site medical clinics, typically primary care and occupational health clinics, on an employer's work site or near an employer's work site. There we staff it with medical professionals, MDs, DOs, mid-levels, which are considered physician's assistants or nurse practitioners, and nurses. And employees and their dependents are able to come into the center for care. Not only are we able to greatly impact, and you can go to the next slide if you don't mind, the delivery of care for a patient, because this program is specifically formulated for your utilization out in the marketplace. Patients are going to be able to get in same day for care, so access to care is great. Typically, for anything that happens in the four walls of the clinic, there's no copayment, and we'll talk about that in a little bit more detail too. But as Paul alluded to, one of the main reasons that Care Here was founded was to really take self-funded health insurance plans another step further to realize cost containment solutions. Billing is very transparent. For those of you that are familiar with the medical care system as it exists today, it's a very fee-for-service based world. It's run on CPT codes. By the time you've left your primary care doctor's office, they've processed anywhere from 4 to 6 CPT codes, which are procedural codes that have a cost associated with them where the provider gets paid. In the Care Here world, we're moving away from that fee-for-service based world that exists there into a very flat, controllable cost. Staffing, equipment, and supplies are all at a pass-through rate with no markup at all. We have national contracts with LabCorp, who you might recognize as a popular lab processing service. And we get national rates there that we pass along to our clients. We purchase medications that we'll talk about for dispensary services as a pharmacist, not as a PBM, so savings come very quickly there. And then we simply charge a per employee per month management fee to manage the providers in the clinic, to run the EMR, and to offer a robust wellness program. You can go ahead to the next slide. Just to give you a little background on us, as I mentioned, we had our 10-year anniversary in January. We now have 163 clinics operating through, just changed 22 states within the last week, and about 23 within the next quarter, throughout the country. Our employer groups, the majority of our groups are in the public sector. We have cities, counties, school districts, the state government. If you wouldn't mind going to the next slide, I'll show you a snapshot of some of those. These are some of our clients across the country. And as Mr. Formica alluded to earlier, a lot of clinics that we do work with can be shared clinic arrangements. So if that's an opportunity here, it could be a wonderful supplement to the hours that your clinic would be open, as well as shared services and cost sharing between different entities. Some of the examples here, you'll see the state of Montana. They're probably the largest shared clinic arrangement that exists. The state of Montana started their on-site clinic in 2012, Labor Day weekend. Since then, all of the cities have joined on to the state's clinic. The university system has joined on to the state's clinic, and the school trusts around the state have joined on to the state's clinic. And what that affords all of the patients is more accessibility, more hours, and cost sharing for services for the state, which has been great. And you'll see a few other examples: Montgomery County, Alabama, Galveston, Texas. All of those are in clinic shared with cities, counties, and school districts sharing clinic options. So I'll spend a little bit of time on the next slide. What I think we're all accustomed to out in the marketplace, and I don't know how many of you all have had a wait longer than an hour at a doctor's office, but I certainly have, is a very doctor-centric model. The doctor will see you now. What we're attempting to do at Care Here, and what we feel like we've done since our inception in 2004, is build a patient-centered medical home where all care is focused around the patient. The appointments are booked in 20-minute intervals. Sometimes there might be a 40-minute appointment depending on the type of visit. But there's no double booking, there's no triple booking. So when you go in, you are the only patient that has that appointment slot. So what that means to you is little to no wait in the waiting room. We also strive for same-day appointments, so you can get in, you have access to care. You're in and out, you leave with your medication in hand. We dispense anywhere from 150 to 200 generic-only medications in the clinic, no controlled substances. And typically those are dispensed at no copayment. If there is a high-deductible health plan in place, we will collect a payment for that to make sure we stay in compliance with IRS regulations. Other services that are encompassed in the clinic, we do workers' comp and occupational health services. They can be wonderfully blended into a primary care setting, and again, are a huge cost containment solution for our clients. We do wellness, case management, disease management. If you go ahead to the next slide, you'll see a listing of some of our, up here in the wellness section, some of our wellness initiatives. If a patient comes into the clinic and they're diagnosed as a new diabetic, that patient is able to work with the provider who will then refer them over into one of our case management programs. They'll probably go over into the diabetes management program where they'll work with a registered nurse and a registered dietitian with their provider sharing the exact same medical record to be able to coordinate patient care and get them to a place of better health. Next slide. These just go over some of the benefits. Most of our employer groups, as Mr. Formica had mentioned, the number one reason a lot of groups look at putting in an on-site clinic is reducing overall claims cost, moving visits from out in the marketplace into the clinic where there's typically a 40 to 60% savings per visit for moving that into the clinic. Identifying and treating chronic patients before they get worse. We have an HRA process we'll talk about. Most important reason after starting an on-site clinic that employer groups list that they maintain their clinic is increased productivity. Patients can get to the doctor and have a 20-minute appointment, leave with their prescription in hand, and be back at their desk. And we do patient satisfaction surveys, and time again, patients do list the clinic as their number one benefit. Employee benefits, I think we've discussed a little bit. Most anything that happens in the clinic, our groups decide not to charge a copayment. There's no wait times. They have access to wellness coaches, and they're really able to build a relationship, a trusted relationship with their primary care provider. We find in year one, nearly 20% of the patients we see haven't been to see a primary care doctor in 10 years or more and don't have a relationship with a primary care doctor. So this really affords them the ability to start developing a relationship with one. The process, and you can go to the next slide, starts with our health risk assessment. Included in the Care Here management fee is a 30-panel blood and biometric screening, which is just a couple steps away from a full physical. We use this as a baseline to get an idea of a patient's health. We use this as a utilization driver into the clinic. Sometimes it's a patient's first opportunity to test out the clinic. Every patient, after getting this health risk assessment done, is encouraged to meet with their provider to review the results and then referred into one of the wellness programs and then managed from there on out. This also, as I said, serves as a baseline not only to the employee but to you all, serving as kind of the basis of where are we starting, what is the health of our population, and is Care Here actually doing their job and moving the population through health management programs. And it is HIPAA compliant, absolutely. And I think that's a good point to bring up. Thanks, Sue. We are a private practicing doctor's office. We have to follow the same HIPAA privacy guidelines as any private practicing doctor's office. In fact, you can almost argue the Care Here clinic is more secure because there's no paper, there's no files in the on-site clinic. Everything is stored electronically on an off-site server. So when the browser is closed, there's no personal health information available. So confidentiality is of utmost importance. The town will be shared aggregate reports, never individual reports on a patient's health history. So HIPAA is definitely an important topic that we discuss when we talk to the patients that will be utilizing the clinic. So from this health risk assessment, and you can go to the next slide, we refer patients over into these coaches. These coaches are available to patients in person for group and individual meetings, through the phone, over email. We have 185 different case and disease management programs that a patient can work through, but what's so unique about this program is that the provider and the wellness coach share the exact same medical record. So they're able to partner to manage a patient. The provider can log in and see what interaction the registered dietitian is having with the newly diagnosed diabetic patient, and that registered dietitian can log into the same electronic medical record, EMR, if I'm using acronyms too much, and they'll be able to see the A1C, the glucose checks that patient is getting performed in the clinic. We have a population health management software system called Care Here Connect that the town will have access to. That's on the next slide. It's available over internet and Droid. If folks like to connect, I feel like we're turning into an app world. That's definitely an option for our patients. And then on the next slide, you will see a little bit on our pharmacy dispensing. So I had mentioned this before. Here in Connecticut, MDs can dispense, doctors can dispense, MDs or DOs. And we stock anywhere from 150 to 200 generic-only medications in the clinic. They're prepackaged. They're easily dispensed. We can also do mail order. This not only increases generic adherence because most of the medications are dispensed at little to no copay, but also helps with medication adherence in general for chronic patients who have easy access to their medications on site. For any medication that's stocked in the Cure Here clinic, we're saving 50% of cost just by stocking that medication in the clinic. It's a great utilization driver too. If folks know that their medication is going to be on site in the clinic, it's a big driver for having them test out the clinic as an option for their primary care services. The next few slides talk about ROI, but I'm sure you're probably interested to see your ROI. But I'll talk very briefly about the 3 different ways that we look at savings. The first is what I've touched on several times, which is simply moving visits from the marketplace into the clinic. We take a look at what you're paying with your plan, and you're a self-funded plan, so the clinic works beautifully in this way for a transparent look at a cost shift from the marketplace into the clinic. And then we take a look at what the all-in cost is in the Cure Here clinic for pass-through staffing, equipment, and supplies. So you can see this is an actual client of ours. Their cost in the marketplace for the same services was $137. That was taken from their historical claims data, and their cost in the Cure Here clinic was only $49.05. So the more visits that we could move into the Cure Here clinic, the more this group saves. The next example is pharmacy dispensement. I had mentioned that for any medication that's moved into the clinic, there's typically about a 50% savings. So that's a big one there. And then third, and probably the largest area of savings occurs some in year 1, but in year 2, after we've had the opportunity to identify chronic patients and we're able to start managing them through our patient-centered medical home approach. You'll see here an example of a diabetic patient and the savings of $27.05 a year when they're managed in the Cure Here clinic versus outside of the Cure Here clinic. The next slide, this is a school district that we work with, about 1,800 employees, and they've been with us for quite some time, as you can see from this chart, but over $15 million saved in the time that they've been with us, which is pretty exciting. Reporting is on the next slide. Everything that is captured in the electronic medical record is reported on. You will receive reports from us on a weekly basis showing utilization, so we can closely monitor how many hours your clinic should be open. You'll receive, of course, financial reports, different wellness and operational reports. These are just some of the buckets of things. And then to take it a step further, on the next slide, you'll notice that we are able to bring in not only clinic data, but also take a look at medical claims data, pharmacy data, other wellness vendor data that you might have captured, all into our data warehouse. So when a provider is looking at a patient record, they're not just seeing the sliver that is clinic, but they're seeing the big picture. What providers, what specialists they're going to out in the marketplace, if they've had any procedures, what medications they're on. So the provider can really give them the best plan of care by having all that information at their fingertips. The next slide just goes over our operating model. You will be assigned a Director of Client Clinic Operations, a DCO, who is your go-to person, but also manages the day-to-day operations of the clinic. They're typically an RN that has management experience in the clinic, but they oversee the providers, the wellness programs, and they do strategic analysis on the reports and strategic planning with you on what's the next thing that your clinic is ready for. We have a 24/7 call center. It's staffed by RNs. About 82% of appointments are scheduled using the online scheduler, which is really easy to use. You can schedule an appointment in under a minute. But we also have a multilingual nurse line, which is available for triage or to schedule an appointment as well. Our timeline is 16 weeks from contract signing. Most of that time is spent recruiting a provider. We recruit providers from within the network. They are within your network, and they're familiar with referral patterns and have privileges at local hospitals. You all have the opportunity to interview and do the final say and thumbs up on what provider is working in your clinic. It is so incredibly important that we find a provider that fits the culture and the personality of your group. And we do the due diligence and credentialing, but nobody's going to know better than you all what type of provider and what personality is going to fit with your members. So we absolutely want you involved in that recruitment process. That does take up some time, as well as facility preparation and selecting the clinic location, doing the outfitting. scheduling the employee communications. We love to go around to department head meetings, and we will do as many at early hours and late and weekends that we need to get the word out. And then data transfers for eligibility and the data that I talked about from your plan, your medical plan. And then we're ready to open after 16 weeks with a ribbon cutting, hopefully, which is an exciting event. So I will go ahead and jump over then into the projections, which if you pull up on the computer, the Excel document, and for those of you seated, it looks like this.
Will it come up on this?
Yeah, we'll just have to, PDF wouldn't, but Excel would, so we're going to be looking at
so
it
you've
in
got the-
Excel.
You're going to have the numbers?
Yep, they're right here. Yeah. So if we go ahead and jump to the executive summary on the Excel, which will be the first page as you open up your packets, we're going to look at projected savings. So to kind of give you an overview of how this projected savings is generated, we use your historical claims data. So from your carrier, we took that data and...
May I just interrupt you, Jess, and make sure
Absolutely.
that everybody understands that this is data directly related to the town of East Lyme that we went, provided, you got, and correlated together to make these projections. These are not summaries. These are from real numbers.
Absolutely correct. Yes. So yes, we took your historical claims data, and since you are self-funded for your medical plan, this is a it's a very easy equation. I hope I do a good job of showing you how easy the equation is, where you're really just doing a cost shift from your self-funded plan into the clinic for primary care services.
Do you need a laser at all to identify?
If you have one, I'll use it, but otherwise I'll just try to talk through, and maybe you guys can follow along with my number reading. But this is just a summary, an accumulative summary of year 1, year 3, and year 5 savings that you'll see. As we go into the next page, this is probably where I'll spend the majority of my time, which is